As my disorder, I chose pyromania. I chose pyromania because as a little kid I liked to play with fire, and I knew it was bad, but I didn't. I just played with fire when we were grilling and everything, and that just and pyromania just seemed an interesting disorder to talk about. And what I learned about pyromania is that pyromania is more extreme circumstances can be. Pyromania can be an impulsive control disorder to deliberately start fires to relieve tension or for gratification or relief. Pyromania and pyromaniacs are distinct from arson, the pursuit of personal, monetary, or political gain, or the intent to conflict harm for advantage or revenge. Also, pyromaniacs start fires to include euphoria and often fixate on institutions of fire control like fire stations and firefighters. Pyromania is a type of impulsive control disorder. Also, pyromania is a rare disorder with an incidence of less than 1% of most studies. Also, pyromaniacs are a very small portion of psychiatric hospital admissions. Pyromania can occur in children as young as age of 3, though such cases are rare. Only a small percentage of children and adolescents arrested for arson are child pyromaniacs. 90% of those diagnosed with pyromania are male. Based on a survey of 9.282 Americans using the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, impulse control problems such as gambling, pyromania, and compulsive shopping collectively affect 9% of the population. Some causes of pyromania, it says most studied cases of pyromania occur in children and adolescents, and 90% of all pyromania cases are male. There is a range of causes, but an understanding of the different motives and actions of fire setters can provide a platform for prevention. Common, cause, Common causes of pyromania can be broken down into two main groups: individual and environmental. Individual factors that can lead to pyromania mainly deal with personal issues in someone's life. This category includes adolescents who have committed crimes in the past. For example, 19% of adolescents suffering from pyromania have been charged with vandalism, and 18% are nonviolent sexual offenders. Other causes may include the seeking of attention from authorities or parents and resolving social issues such as bullying or lack of friends. Another cause may be that the patient is subconsciously seeking revenge for something that has occurred in the past. Some environmental causes, factors that may lead to pyromania include the patient has had an event the patient has experienced in the environment they live. And environmental factors include neglect from parents and physical or sexual abuse in earlier life. Other causes include early experiences of watching adults or adolescents using fire inappropriately and lighting fires as a stress reliever. Some symptoms of pyromania is that there are specific symptoms that separate pyromaniacs from those who start fires for criminal purposes or due to emotional motivations not specifically related to fire. Someone suffering from this disorder deliberately or purposely set fires on more than one occasion. And before the act of lighting the fire, the person usually experiences tension and an emotional buildup. When around fires, a person suffering from pyromania gains intense interest or fascination and may also experience pleasure, gratification, or relief. Another long-term contributor often linked with pyromania is the buildup of stress. When studying the lifestyle of someone with pyromania, a buildup of stress and emotion is often evident, and this is seen in teens' attitudes towards friends and family. Some treatment and prognosis. The appropriate treatment for pyromania varies with the age of the patient and the seriousness of the condition. For children and adolescents, treatment usually is cognitive behavioral therapy sessions in which the patient's situation is diagnosed to find out what they may have caused this impulsive behavior. Once situation is diagnosed, repeated therapy sessions usually help continue to recovery. Pyromania is generally harder to treat in adults, often due to lack of cooperation by the patient. Treatment usually consists of medication to prevent stress or emotional outbursts, in addition to long-term psychotherapy. The prognosis for recovery in adolescent and children who suffer from pyromania depends on the environmental or individual factors involved, but is generally positive. In adults, however, the recovery rate is generally poor, and if an adult does recover, it usually takes a longer period of time. Some preventions from pyromania pyromania is best prevented by parents taking the time to educate their children on fire safety and the dangers of fires. Parents should also keep all fire lighting devices out of reach of children and any teenagers to reduce the risk of their starting any fires. So there you go, some causes, some symptoms, and some treatments would be cognitive behavioral therapy, self-help groups, psychotherapy, and medication as appropriate to prevent aggressive outbursts and anxiety. And that's the sort of chose pyromania. Thank you for watching.